Is deep brain stimulation, DBS, used for Wilson's disease? Have you ever wondered if deep brain stimulation, or DBS, is a treatment option for Wilson's disease? Wilson's disease is a genetic disorder that causes copper to build up in the body, particularly affecting the liver and brain. This accumulation can lead to various neurological symptoms, including dystonia, tremors, and other movement disorders. DBS has been explored as a treatment for some of these symptoms, especially for patients experiencing severe dystonia or tremors that do not respond to standard medical treatments. In particular, DBS targeting the internal segment of the globus pallidus has shown promise in treating dystonia in Wilson's disease patients. Some reports suggest that this approach can lead to improvements in dystonia and related symptoms, particularly when other treatments, like zinc acetate, have failed. Another target for DBS is the ventral intermediate nucleus of the thalamus, which has been used to address tremors in Wilson's disease. There is some evidence supporting its potential benefits, but the overall effectiveness of DBS in this context remains uncertain. Some studies have found that patients may not experience significant improvements in their symptoms after undergoing DBS. This variability may be influenced by structural changes in the brain caused by copper accumulation, which can complicate treatment outcomes. It's important to note that while DBS is a well-established treatment for Parkinson's disease, its application in Wilson's disease is still considered investigational. DBS is generally reserved for patients with severe motor symptoms that have not responded to other therapies. The choice of which brain area to target with DBS may depend on the specific symptoms a patient is experiencing, whether they have phasic or tonic dystonia or Parkinsonian features. In summary, DBS can be used selectively for patients with Wilson's disease who have severe dystonia or tremors that do not improve with medical therapy. The most common targets for DBS in this context are the globus pallidus internus for dystonia and the ventral intermediate nucleus for tremor. However, the results can vary widely among patients, and DBS is not considered a standard treatment for Wilson's disease. It should only be pursued in specialized centers with the necessary expertise. If you or someone you know is considering this treatment, it is crucial to consult with healthcare professionals for personalized advice and thorough evaluation.